Alright, today I'm just going to do a small demonstration of pelvic adjustment, lumbo-pelvic adjustment, typically done by chiropractors. There are techniques I'm not going to cover here, so not every chiropractic clinic would recognize exactly what I'm going to be doing there as what they are doing as well. So don't exclude others from what I'm going to be doing here. But at least in our clinic and in most chiropractic clinic, the aim of a pelvic adjustment here would be to even the weight bearing right onto both sacroiliac, the sacrum, avoiding any rotation on the lumbar spine here. So basically in opposition to some other methods of readjustment, physiotherapy, osteopath in particular, chiropractors' aim is to be as accurate as possible in their thrust, okay? The accuracy allows to be less forceful, but also less general in the movement. So when osteopaths use long levers where they would stretch everything that way, on the side, as I'll show you a bit later on today, chiropractors would try to isolate the joints. And how do you isolate the joints? By doing tests to see which one is the one that needs to be adjusted, but x-rays are a great support for that, okay? But like I said, it allows us to use techniques that are soft and gentle. So in this particular gentleman who suffers from a chronic low back pain with a touch of sciatica, we see that his pelvis is slightly rotated just from the leg length, the right leg being a little bit shorter than the other. And it's confirmed when we're putting pressure on his pelvis like this, that the right hand side here is also a bit restricted. So we're going to correct that artificially by putting wedges under his pelvis. Again, I'm doing very generally here. I know his condition particularly, so it allows me to do it like I generally do for him, and that relieves his symptoms. So we'll just correct the pelvic alignment by the wedges like that. It's not having a huge effect, or the effect we are expecting by just doing that. So we need to leave him like this for a few minutes, and as he's also suffering right there with a slight rotation of our 4L5, we will use what we call an activator. Again, that's very common to chiropractic clinics. It gives a very quick thrust on the joint, and the speed on the joint, the speed of the thrust is even more important than the leverage you're going to put on. That's been demonstrated, that's been researched. So we will put a little impact here on L5 to try to increase the mobility on L5 again, and rotate the pelvis, facilitate the pelvis to go into that rotation as well. Okay, so once you've done this kind of adjustment, wait a few minutes, see if everything is relaxing very well, and that could be over a period of a few minutes enough to change what you need to change. Now, if that doesn't work, some chiropractors, and again we use that in our clinic here, would use a drop table, which is what I'm going to show you now. So it's a table that you lift one of the pieces off, and with a very quick thrust, you encourage the pelvis again in the same rotation. You ask the patient to breathe in, and as they're breathing out, again, very quick thrust on the pelvis here. The fact that there's a little drop and a period where the pelvis is in the air with no support here with the thrust opens up the joint more than what I've done so far. So it's a little bit more invasive again, but it's not painful, and it leads to great results. Okay, generally, again, that would be enough to make a big difference. Now, if the joint's mobility is not enough still, or if you find that it's not the technique that works with this patient, and if he's not in acute pain, then you use a constant pelvic adjustment, which again, very common to all the techniques of manipulations, but in chiropractic would probably target the joint separately as the other joints, as opposed to opening everything up. And I'm going to ask this patient to lie on his left side. And in the three methods that I've shown you so far, no cavitation, no crack will happen. In the technique I'm going to show you here, it could be that the pelvis will open up a little bit. Okay? You alright? No pain? So I'm going to bring the pelvis into a rotation like this, put the pressure right there, moving the joint up in this situation, like this. In some phenomena, in some situations, you would bring the sacrum down, the ilium externally, internally, the lumbars into rotation. So it looks similar to each manipulation. Could you lie on your front again, please? It may look very similar in each adjustment, but what we're targeting is very different. Okay, so then you're retesting the pelvis. Mobility is good, and you consider that the proprioception there, the sensitivity on the joint inflammatory process will be altered with what we've done so far. Okay, so again, the point of me demonstrating this today is to say, okay, not one situation will be treated like the others. Okay, we will apply different methods, different forces, different treatment plans to every single conditions. Okay, so any questions about, oh, will it hurt? Oh, is it invasive? Chiropractors are strong in their adjustments. Is it true? Don't hesitate, just give us a ring. Always mention the technique that you've been treated with before, and we'll make sure we allow you to feel very comfortable during the treatments as you come and see us. Okay? Thank you very much.